Hi, welcome to the Fit and Healthy Today show. And today our topic matter is rosacea. I had quite a few people come into our stores with this problem, and so as so goes, whenever I see a lot of something, I'll lecture on it. So very, very common. I think sometimes we can kind of tell if there's a reddening. It's an inflammatory skin disorder in which, like your nose and your cheeks, even your forehead, your chin, sometimes you'll just have this kind of rough, thickened type of look. And basically what happens, chronically reddened, and it's very prone to like welts and swelling. But yet what's really interesting, unlike adult acne, is you don't ever develop the blackheads or the pimples that can go along with skin eruptions. So I think like even looking at kind of like President Clinton, it's much more common in women, but when men have it, they get it really, really heavy, and the skin gets very, very thick. Now, when it gets or stays continually inflamed like that, over a period of time, the blood vessels, they get damaged. These fine little capillaries that feed our skin tissues, when they're chronically inflamed, oh boy, then you can end up with actually permanent, to some extent, disfigurement on the face. So this is not something to be taken lightly. You need to address these issues, and the best way to do them in this particular skin condition is by doing it naturally, if at all possible. Anything that dilates the blood vessels or the small capillaries is going to cause it to inflame. So let's go down and look at some of the causes that will tend to trigger this. Or may even make it come about. It's very, very common between, like I said, women between 30 and 50. That's the most common time. And it seems to be a continual lifestyle problem that causes issues with capillaries and digestion. Most skin issues do have something involving the digestive tract that's faulty in some way. So let's go through the causes. Repeated exposure to alcohol, hot liquids, coffees, spicy or saturated foods, extreme temperature exposures, sun exposure. These are all things that can trigger rosacea inflammatory response. Now, looking at the potential direct causes of it, I think a lot of it has to do with inadequate amounts of B vitamins or nutritional deficiencies, support of the skin tissues healing, which would be your vitamin C, your vitamin D, your vitamin Bs. Overall nutritional deficiencies, like most of the things that we discuss, seem to be the major contributing factors. Low stomach acid secretion. I know a lot of people will think they've got acid reflux when truly what they have is inadequate amounts of stomach acids to break down their foods, and then they get that acid reflux. Well, when you don't break down your foods, it goes into your bowel and it can cause inflammatory responses and then poor nutritional absorption of your foods. An imbalance of good bacteria in the gut. Especially if you are using a lot of antibiotics or steroidals, it'll destroy those little good critters down in the bowel, and you can throw all the yogurt you want on it that you want. If you're taking an antibiotic that destroys trillions of your good bacteria in your bowel, good luck with your million-a-day yogurt. It'll take you about 2,000 years to reestablish that flora. So don't fall for it. You need to go into a good health food store and get probiotics whenever you're on antibiotics. And if you're on continual usage of antibiotics or steroidals, you need to do it on a continual basis to maintain that good gut bacteria. Low fiber diets and constipation. Remember, if you don't go 2 to 3 times a day, and that's what's normal. Most people are like, oh, this is so inconvenient, but your body needs to eliminate those toxins and get rid of things. And if it doesn't, it sits in there and it just gunkifies, and then the body can reabsorb it and process it all through the circulatory, the liver, and the kidneys all over again. So keeping a high fiber diet and keeping the bowels moving is very important for elimination of toxins for any disorder that we talk about. We discussed nutritional deficiencies. Might help if I work on my spell check here, but sorry about the misspellings. Hormonal imbalances or reactions to synthetic hormones. And we see this a lot, obviously, in perimenopausal women or women who have tend to have endometriosis, or people who have a lot of inflammatory higher estrogen amounts. So birth control pills, Premarin, those types of things can trigger rosacea as well, because there are hormone imbalances that, believe it or not, directly affect the skin, because excessive amounts of estrogens increase inflammatory responses. Now, I should say excessive amounts of synthetic estrogens, which include pesticides, chemicals, and some of the pharmaceuticals as well. Our natural estrogens produced by our body, primarily estriols, are extremely anti-inflammatory and very good for us and very youthing, helping maintain bone health. So it's really interesting. Most people I mention sometimes that they might have a little bit of skin mites, and they're like, what do you mean skin mites? There are these little small little mites that can get in the skin, and they kind of make a little home and they eat what's there. And there are soaps that are primarily sea buckthorn related or have that ingredient in it that can kill off these little mites. You can find them at good health food stores. But what it does is basically, I would always look to see if maybe that might be a possibility, because it's very, very common, especially if you don't change out your sheets or your pillows, or you don't have that little pillow protector on there. Because I know we talk about dust mites, but mites come in all different forms, and some of them like to bore under our skin, particularly our face as we're rolling around in our pillow. So keep the pillows clean, changed, and then if you suspect you've got rosacea or you're diagnosed with it, I think that might be an option that you might want to look into. The diet. I can almost just photocopy this for just about anything I talk about. And obviously, good, wholesome, lots of good fruits and vegetables, primarily organic again, because once again, the synthetic chemicals that you're going to find in sprayed, the herbicides, the pesticides, the list goes on, preservative sprays. You need to do organic whenever you possibly can, but primarily a lot of raw fruits and vegetables, and not your frozen green beans or your canned corn. I'm talking about good stuff, your salads, your carrots, all those wonderful, good, wholesome, enzyme-rich foods. Avoid particularly greasy foods or saturated types of foods, particularly red meat. And I know for me, if I eat a lot of red meat, I get inflamed. My scalp will kind of itch. I just get kind of inflamed. It produces excessive amounts of something called arachidonic acid, which is very inflammatory. You need a little bit of the arachidonic acid and the saturated fats, but if we eat it too much all the time, it can trigger skin issues, digestion issues, particularly if you don't have adequate amounts of stomach acid secretions. The fried or greasy foods, particularly the trans fats, they're inflammatory by nature. I have more kids come into the store with acne and other skin issues, and if I can just get them to cut back on their bad fats, boy, we watch the inflammation drop. And that's going to be true with arthritis, any inflammatory disorder or disease. If you have more good fats in the diet, which include nuts, those avocados, salmon, those good fats, those are anti-inflammatory by nature. So eat more of those and a little less of the red meats and the saturated fats. And of course, always drink lots of water, and then veggie juices. Now, keeping carrots and apples and things like that to a minimum. When we're talking about veggie juices, we're talking about things like celery, spinach if you don't have kidney stones, other types of greens, kale, whatever you can throw into that juicer with a little bit of carrots and maybe a little bit of apple. We don't want to mess with the blood sugars too much, but those types of juices are very detoxifying on the liver. And they're detoxifying on a cellular level as well. So if you do tend to have a bout with this, I would do tons of raw fruits and vegetables and maybe a little bit of juicing. Supplement-wise, there's lots of things that we can do to overcome these and these. But I got to tell you, diet's number one, always, in everything we do, particularly with the organic fruits and vegetables. And organic meats when you can get them too. Because remember, milk and meats, things like that, nowadays there's growth hormone, there's chemicals, so whatever you can do in that regard to be as chemical free as you can, please, by all means, do so. Supplement-wise, I know I list quite a few things on here. I usually suggest to people to try a couple of things and see what works, because see what may work very well for me, something else might work very well for you. So I'm going to point out the things that I think are paramount to most people. Number one I'm seeing with rosacea that we've seen good results with in our customer base are digestive enzymes with a little bit of what's called betaine HCl. And what that is it adds in a little bit of amylase, protease, and lipase, which are enzymes that digest fats, proteins, and carbohydrates, along with a little bit of stomach acids to help break down the foods, particularly when you're eating proteins and fats. It's really important if you have inflammatory issues to utilize these enzymes. In combination with doing a good multiple vitamin and at least a B50, what's called a B50, twice a day, in combination with at least 2,000 milligrams of vitamin C per day. Those are the basic things. If you got the diet in order, where you're getting enough good nuts, avocados, things like that, then we're going to see a reduction in symptoms. I mean, it just works. With people that don't get good enough fats or who have inflammation that's out of control, then adding in a really good quality fish oil. And I'm talking good quality, not one from your local grocery store or your large warehouse where it's not PCP, mercury-free, and of finest good quality. A customer of mine brought one in the other day, and it says fish oil, you know, and I look on the back and I turn it over, and it had 870 milligrams of fish oil, and the rest of it was soybean oil. And she thought she was getting fish oil, and she was allergic to soy. So what she thought was a bargain wasn't so much of a bargain, because almost a little bit more than a half of it was fish oil, not the rest of it. So being very aware, you want a pure, clean fish oil for that's mercury and PCP chemical free. Okay, and there's different brands out there. You got to look on the label on your bottles. Once again, not the grocery store is not a good place to go in and find your fish oil. You want a pharmaceutical grade, good quality. Very anti-inflammatory for rosacea, arthritis. You name it. Helps the bowel move along. The government tells us we need 20 to 25 grams of good fats in our diet every day, and most Americans aren't getting it. It just isn't happening. Most Americans don't eat nuts and fish. They don't do it. And so as a result, we get more inflamed. So having the fish oil, I do a Carlson's liquid fish oil, and I down it, and in the old days, my grandma would give me cod liver oil, gag, gag. But the newer fish oils out there nowadays, they taste good and they work. Probiotics, the good bacteria, we talked about that earlier, particularly if you're on an antibiotic or if you do steroidal to reduce inflammation, steroidals. It's going to help, bottom line, increase your immune system and how your immune system reacts and responds, and your body's ability to eliminate these toxins. Very, very important. There are vitamin B12s, and I know a lot of people love to go in and they'll get their B12 injections. They're painful and they're expensive, but there is now out there what we call sublingual B12 that goes under the tongue. It melts, and there's a methyl source that wonderful absorption, and it can actually help with some of the healing of the skin, and it also helps with other nerve issues and energy and that type of thing. But it does reduce flare-ups, and about 1,000 micrograms a day can be very, very helpful. We're going to discuss natural progesterone later on. There are some herbs that we can take that are very good at reducing inflammation and blood purifiers. For example, burdock root, gentiane, they are detoxifying agents that can help cleanse the blood. They reduce inflammatory responses. And then milk thistle, because remember, the liver performs over 500 different functions. If my data is right there, it may be more than that, obviously. But milk thistle improves liver function and helps the liver detoxify. Other things like artichoke and dandelion root, those are all things that can help liver bile excretion that can help you detox. But milk thistle has double-blind placebo clinical studies on it as far as liver enzymes and liver repair and reduction of inflammatory. In Chinese medicine, the liver is the center of the body, and it does so many different things. I mean, obviously you can't live with your heart and your kidneys, but you cannot live without a liver under any circumstances. You will die. So taking good care of the liver, detoxifying it, moving it along, will reduce things like cholesterol, rosacea, all those other inflammatory issues as well. Essential fatty acids. Now, we talked about the fish oils and the ability to get those, but if you're a vegetarian And there are other alternatives, obviously the nuts, and then there's things like flax oil, sunflower oil, the list goes on, that are grapeseed oil. These are all good fats that can help reduce inflammation as well. So you have options. You don't just have to think in terms of fish. Super green foods. Now we talked about how necessary vegetables are for detoxification. There's a classification of foods that are called super greens, and they help you detoxify quicker, faster, and better on a cellular level, and they alkali the blood. So those can be very helpful as well. There are bunches of homeopathics depending on your symptoms, and the homeopathics safe with any medication that go under the tongue and that can reduce flare-ups, responses depending on, because some people respond to different things. Most people respond with rosacea having to do with heat. But these homeopathics can be very helpful for symptoms as well. Since we know that it attacks, or it seems to overcome women between 30 and 50, we notice about that time that progesterone levels fall in women, particularly in that perimenopausal phase. And sometimes, I know with me, I've suffered from skin issues, the progesterone and natural progesterone issues, not synthetic progestins, but natural progesterones do reduce inflammation and help bring hormones a little bit more back in balance. That you can talk to your natural healthcare provider. Most doctors are not educated in natural progesterone usage. Suzanne Summers has a couple of books that talk about this, and you can inform and educate yourself with online information as well too. The Mayo Clinic has a lot of research on natural progesterones and their ability to reduce inflammatory response. As a conclusion, obviously if you have rosacea, you've got to avoid midday sunlight or excessive amounts of heat. My mom had a mild case of it. She would go out and she would break out in hives from the sun. So keep it to a limitation. You take your supplemental vitamin D if you can't get the sunlight. And then, I hate to ever say avoid exercise, but avoid intense exercise when you're having a flare-up. So anything that makes you sweat and really overheat, but if you're in your fat-burning mode and range, you're smooth sailing. Anyway, we're going to be moving on to the next portion of our show, which is our fitness portion. Thank you very much. Hi, welcome to the fitness portion of our show, and today we're going to be working on 6th chakra, and I want to read to you basically what this is. This is between our eyes, also known as our third eye, which involves our intuition. And when you're balanced, you're clear, you're intuitive, you are insightful, you're respectful. And when you're out of balance, you're doubtful, mistrustful, intellectually arrogant. We see a lot of that recently in our politics. Isolated, unspiritual, just seeming to be somewhat detached. Now there's a very good exercise for this, and it's very simple, and you don't have to sit on the floor like this, but I have this nice little Via Brazil, thank you to the Vitamin Herb Store in Orcutt for this, and very flexible and pliable. We sit down in a nice comfortable position. If you're not able to get down on the floor, you can sit in a chair and do this as well. What you're going to do is we're going to be working primarily with movement on your eyes. So if you have hard contacts in, you shouldn't be doing this exercise. Soft contacts, you're going to be fine, but you'd have to remove those contacts first. And what we do is we cover the eyes, which obviously they say are the keys to the soul. You cover those up and just give yourself a few moments of darkness, and then we open them up, brightness. Then we're going to look straight up and down and up and down. We're going to go north, south, or 12 o'clock, 6 o'clock, 5 times. Then we're going to look over, and we're going to do 3 o'clock to 9 o'clock, 3 o'clock to 9 o'clock, 5 times back and forth. Then we're going to do 11 o'clock down to 5 o'clock, 11 o'clock to 5 o'clock, and then 1 o'clock down to 7 o'clock. What we're trying to do is we're trying to hit north, south, east, west, west to north or southeast. We're trying to get that cross rhythm and movement in the eyes. What this does is this helps bring into balance the chakras for what we call our third eye. This is also a very good exercise to strengthen the muscles in the eyes as well, so I think your eye doctor would approve as well. Thank you very much for joining this portion. Next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
Thank you for the intro. Well, how long do you think it would take to keep body fat off once you lose a large amount, or how much exercise do you think would be involved? Well, normally you should think that you do 60 minutes of exercise per day to maintain your weight, which seemed, pretty good for an exercise program, but surprising even to me, it doesn't even require that much exercise. What they did is they took a group of people and put them on 800 calorie a day diets for 24 weeks, which to me is a little extreme, but the results were surprising. With as little as 80 minutes of exercise per week, let's break that down, it's 11 and a half minutes, 12 minutes of exercise per day. They basically regained no visceral body fat after an entire year. The group that did not exercise regained 33% of their visceral body fat back as far as the control. So you're talking just 11 and a half minutes of exercise per day. That's like running from one side of the mall to the other at a slow pace. Doesn't take a lot to do a lot, which is pretty encouraging because you don't want to have to make your exercise a second job unless you enjoy it. But very little effort does a lot of good. Now here's another one in regards to vitamin D. I'm kind of getting old and I'm trying to avoid a lot of subjects on vitamin D unless they're really important, because you'll find a lot in the media recently. Well, this is important. When it comes to end-stage renal, end-stage renal disease, especially among African Americans, they discovered something very interesting in regards to vitamin D. They said that low levels of vitamin D increased your risk of going on kidney dialysis by 60%. 60%. The reason that's important because vitamin D is especially important for African Americans themselves. So, just a little bit of extra vitamin D, maybe 400 IUs minimal, 1,000 IUs, can really keep a lot of people off that kidney dialysis machine. And there's one thing that people do not want to be hooked to, is that type of machine, one way or the other. So a little bit of effort, again, goes a long way. Really worth the $5 to buy a 100-day supply of vitamin D, especially if it's going to keep you off that machine. And then finally, congratulations. We finally have the first national zinc campaign for childhood diarrhea, which increases its awareness because zinc has been proven and shown over and over again to be great for preventing diarrhea. This comes from the International Center of Diarrheal Diseases. Believe it or not, there is actually a center for that because it kills a lot of kids all around the world every year. In fact, they discovered this. The use of zinc was found to be safe with few side effects. Obviously, if you do zinc on an empty stomach, it can make you feel a little nauseous. It did not affect the use of traditional treatments for diarrhea, so it didn't interfere or contraindicate with other medications. In fact, they said, quote, clinical trials showed that zinc can help reduce the severity and duration of diarrhea, as well as lower the likelihood of a repeat episode in the future. It is so profound in its effect on childhood diarrhea that zinc is now included in the guidelines for the World Health Organization for treatment for childhood diarrhea. And this was courtesy of what's called the Scaling Up Zinc for Young Children, which was actually funded by the Bill Gates and Melinda Gates Foundation. So incredibly good advertising campaign. Only problem with it? It's in India. Hardly anyone in the United States knows about zinc for childhood diarrhea. But we do our best to inform the rest of the world. When it comes to us, well, I guess we're kind of left off from the short bus on that one. All right, here's an interesting one. Why are boys turning into girls? Now, this came out of Denmark. They're becoming greatly concerned about the ratios of boys to girls beginning to change. Usually 106 boys to 100 girls. They believe nature did that to take into account the more risky behavior of boys, wars, and things along those lines. But why? Well, they said, quote unquote, here's something rather rotten from the state of Denmark. It unveiled official research showing a bewildering array of gender-bending chemicals in the environment, coming from waterproof clothes, rubber boots, bed linen, nappies, sunscreen, food, moisturizing cream. It was a 326-page report, which is incredibly disturbing to them. They said, quote unquote, a picture is emerging of an ubiquitous chemical contamination driving down sperm counts, feminizing male children all over the developed world. How bad and how fast is it reacting? Well, quote unquote from the article again, sperm counts are falling so fast that young men are less fertile than their own fathers and produce only about a third as much sperm as their father did. That's an incredible thing when it comes down to fertility. It is dropping rapidly. Think global warming is going to get you? No, this will be way ahead of the curve. In fact, they said they blame the mystery what they call the lost boys syndrome, meaning there should be a lot more boys than there are girls, but it's not happening. And they found out this is coming from all different sources, these chemicals, especially sunscreens. Keep that in mind. These chemicals are, they found out a gender bending, are dioxins, PVCs, flame retardants. There's where your bed linens come in pajamas and things like that. Phthalates, accepted to use for like softening plastics, and also, believe it or not, now largely banned, PCBs. The contamination may also offer a clue, in their words, to the mysterious shift in the sex of babies. Normally, 106 boys are born for every 100 girls, like we discussed, and we discussed why. But there is now, basically in Japan, the United States, almost proportional to the same number, about 250,000 missing boys that should have been there but are not there. The genders are beginning to change quite rapidly. In fact, in one Indian community where they had a high level of these estrogenic chemicals, it is now 2 girls being born to every 1 boy. And so it doesn't mean that a boy necessarily is a masculine boy. There are cases where they thought children would be born boys, but end up being girls in the end. Very disturbing, very controversial, and right now, unless something's done about it, it can create some issues in the future, without a doubt. Now, going down to pregnancy again, another thing that's basically hurting our fertility rates and other problems is antidepressants being given to pregnant women. Now, if you had to guess, what is your risk of a premature birth if you are on antidepressants? Remember a few years ago, they said that basically the antidepressants didn't make a difference when given to pregnant women? Well, it actually triples your risk of premature birth. And so that's something to keep in mind. And I want to end this up real fast with Pfizer's basically blatant studies in Neurontin. Pfizer recently got caught fabricating studies for this anti-seizure medication for headaches, migraines, and you name it, nerve pain. They were caught lying. So it basically, since it's short on time, research Neurontin. And thank you very much in regards to that.
Wow, along with the other side effects that go with Neurontin. Thank you very much for joining our show. Research, look into things for yourself. Thanks a lot.